Good evening. Hello, everyone. Welcome to Laser Therapy Reimagined. My name is Dave Cavanaugh, and I'm the Vice President of Sales here at Lumenis. Lumenis has a proud history of over 53 years, which we have produced 220 patents, over 80,000 lasers, and 100 plus countries in the world where we're distributed. Our company pioneered the first photo disruptor, the first photocoagulator, the first LIO, the first combination SLT YAG laser, the first 3-color laser, and the first IPL. Next. Introducing tonight, we introduce the latest advancement in laser technology designed for today's challenging practice, the Lumenis Digital Duet. Next.
What if you could reimagine laser therapy? Connect better with your patients, students, and peers. What if you could streamline your workflow and improve practice efficiency? Have an imagery device and laser combined in a single system. The next evolution in glaucoma laser therapy is here. Digital Duet, laser therapy reimagined.
We're honored this evening to be joined by Dr. Nathan Radcliffe. Dr. Radcliffe, I'm sure a lot of you know him or heard of him. He is a world-renowned lecturer on glaucoma and micro-incisional glaucoma surgery. He works at the New York Eye Surgery Center and instructs at Mount Sinai School of Medicine. Dr. Radcliffe this evening will be able to share his thoughts and observations on the new Digital Duet. Welcome, Dr. Radcliffe. Please take it away.
Thank you, David. It's a pleasure to be here. And, it really is the case that talking about laser therapy for glaucoma is one of my favorite topics. So it's an honor for me to be a part of this project and speaking to all of your audience here tonight. We have a few relevant disclosures here. I did, in fact, just come from a busy day of laser. And while talking about how the Digital Duet has transformed my practice, I'm going to tell you a little bit about my glaucoma practice before and after I was able to adopt this laser. I'll say that before, life was pretty good. I had a state-of-the-art laser. I've worked maybe at 5 or 6 hospitals over my career. I've always used the Lumenis lasers, so I've been very fortunate to use all the different models, I think. And they've all worked great, but it's also the case that they've all just been lasers, and I'm now learning that a laser can be much more. If you've ever followed me on Twitter, you'll quickly learn that I love ophthalmic photography, but it can be very difficult to get good ophthalmic images. Perhaps for something happening at the slit lamp, you can use an iPhone. But when it comes to capturing dynamic procedures where you're using your hands, perhaps to fire a laser or to get a video of something, the phone doesn't work, and ophthalmic imaging systems can be prohibitive. Here's just an example of myself trying to do gonioscopy and take an iPhone photo at the same time. And you see an image which, if you use your imagination, looks like it could be the angle, but the quality isn't acceptable. It's not acceptable for teaching, and it's not really acceptable for presentation. So a lot of challenges there. I did look into it at a variety of times getting slit lamp cameras, and those are very pricey. And they take up space, so you're probably going to have to dedicate either part of a room or maybe even a full room to that technology. And they're just very expensive, and sort of beyond that, they require their own integration into the EMR. They'll take out a slit lamp. You're going to have to update software and get licenses, and it just adds a whole nother wrinkle that really is just maybe a little bit more complicated than it needs to be. Some of the other things I noticed that, although I enjoy doing lasers and I think we have a reasonably efficient process for doing that, there are some things that haven't made that much sense to me. At one of my practices, we had a laser log, and we would record everything on paper while the laser was going on, because it wasn't that practical to have a separate EMR connection. Sometimes lasers are done in ASCs, sometimes they're done in the office, and that can create EMR compatibility issues. Ultimately, you want a treatment summary, and sometimes it's nice to share treatment summaries and reports to referring doctors. All this was done before manually, and there's just no connectivity. So ultimately, if I didn't have access to that paper printout, I even had to sign separate laser reports after we already created our handwritten report. So it was inefficient and time consuming. With Digital Duet, we now have an integration between the experience of the laser and being able to capture all elements of that laser, whether that is a video snapshot of some pathology, whether it's the actual laser treatment itself, or whether it's my laser settings in the report. It's all integrated now. It's all on one machine. And so this has all been brought together, and I'll give you some examples of how that works. One of the key things that we can do with Digital Duet is capture images before, during, and after a procedure has been done. The other thing you can do is capture images on patients who aren't having lasers. So you can use your laser on a non-laser day for just simply getting videos of procedures that you're performing at the slit lamp type setting, or capturing images of interesting pathology, from the very practical issues of perhaps photographing a corneal ulcer or corneal abrasion, to more interesting things such as performing some sort of slit lamp procedure, bleb needling, or anything like that. Here is just an example of a case where this is an eye that has a very compromised angle. This is an eye that couldn't have a laser trabeculoplasty, but may perhaps need a YAG vitriolysis or something along those lines. And we can actually even see a tube shunt there coming into the cornea in this compromised angle. So we can capture pathologies. And there are a variety of times when we might do this for a patient's sake, to explain what's going on in their eyes. We might do this to document something that has happened before we intervene. Pre-surgical planning, pre-laser planning, all these things have value. Here is an example of an eye that is pre-iridotomy, and I'm in low light, and what you're going to see is maybe just a faint hint of the trabecular meshwork back there, but mostly it's a closed angle, and I'm going around to different portions of the angle here. And this is all live being recorded. And you can see not too many angle structures. Well, now we're going to move on to the iridotomy procedure. If I have a family member in the room, they can be watching what's happening, or I can show them later if I don't want them in the room during the laser. You can see the fluid flowing through the iridotomy here in real time. And that is a sign, of course, that the iridotomy was necessary. I like to show this, and I'm actually going to show you again. I like to show the pigment rushing through the iridotomy, because that to me shows there was relative pupillary block, there was a pressure differential across the iris, my laser fixed the problem. If I have a patient who, for example, sorry, I'm actually going to go back. So if I have a patient who, later on is wondering whether they needed the laser, being able to show a video like this of the pathology actually being addressed would be really valuable for their peace of mind, and shows that they indeed needed to have the procedure. Now, of course, what I'm going to do next is take a look at the angle again. And if you couldn't see structures on the previous image, I think you'll see them quite clearly now. We can see now a wide open angle. We see a Sampiolisi line, some pigmentation on the trabecular meshwork. This is pathology that's been dealt with by the laser, and we can explain this to the patient. We can show there's the iridotomy itself seen through the gonioscopic view, a nice open angle there. in at least 3 out of 4 quadrants. So that's a good, successful laser, and we could take a picture of that and send it to the referring doctor. We can show our students. Very helpful. Again, here's just another iridotomy procedure, this time done with the sound on. So for better or worse, you'll hear me talking now during this procedure. Hear a little chatter in the background.
Doing good, sir. So I think I just got through. You see those pigment? There you go. So now you see the fluid and through, and then you usually do one more into it. And make sure it reestablishes itself. Watch everything flow out. Beautiful laser.
So there we have a laser procedure for iridotomy, but of course we're often using these lasers for posterior capsulotomy as well. And here we have a video of this procedure. You'll notice I do things like use the patient's eyelid to have them blink to keep the eye moist, and little things can come up. If you notice a patient is drying out during a laser like this, you can show them and teach them a little bit about their dry eye. Of course, we know sometimes after procedures, patients might not see as much better because they have retinal pathology, pre-existing diabetes, macular degeneration. And so if the patient is puzzled why they're not seeing better, I think, revealing a laser that shows the dense posterior capsular opacification, as you're seeing here, being treated, is going to be very helpful for that patient's peace of mind. I will say that in my practice, I deal with a lot of insurance payers that are tough customers. And in some cases, we will try to get a laser approved and they will say no. And we have found that sending a picture of the posterior capsular opacity will help with that clearance. And this is another way that you could do that. So you can use this for educating or sort of demonstrating pathology to insurance companies. You can use the laser to help patients. And then, of course, anyone you're teaching as well would likely find this to be valuable. And I think it's pretty remarkable, seeing how things look after the laser in that setting. And now we have a selective laser trabeculoplasty. As I'll show you this video, selective laser trabeculoplasty is really becoming a first-line therapy. And after the LIGHT study, which I'll talk about in a few moments, was presented, we now realize that any patient with open angles who's on drops can be treated even as a first-line therapy with selective laser trabeculoplasty. When you sit back and think about how many patients now are appropriate for this laser, it's a rapid change. I have always used the laser, and one of the things I've found over the past 10 years is that the earlier you treat, the better it works. We even have information that it works better if the patient's never been on a drop than if you start a drop and then do the laser later. One other part of the digital duet is that it has the Smart V titratable illumination system. And this allows two types of visualization. It allows on-axis and off-axis, and most importantly, because the Smart V splits the light using a prism, it allows the laser to fire through that coaxial view. Bottom line is that you can see pathology in the eye, either on or off axis, which If you're looking at things that are translucent, such as vitreous or posterior capsular opacifications, you can get a better sense of where the pathology is and how deep the laser beam is by switching back and forth between on and off axis. With previous lasers, because the illumination tower would get hit by the laser beam, you couldn't always be in that on axis mode. With SmartV, you can, and it just opens up new possibilities for imaging difficult structures to see within the eye. Personally, I've found that SmartV has value for any type of procedure, whether it's iridotomy or capsulotomy, because the benefits to visualization are so notable. I'm often working in a variety of settings, educating those around me. And I have to say, this isn't just students or residents, but often technicians. And I think the more that everyone else in your practice understands what's happening, a lot of the time the doctor may not be in the room and the patient may be nervous about a procedure. And I think a technician who's seen a lot of these, and not just seen, the doctor doing the laser, but actually seeing what's happening under the illumination and the magnification, will be able to reassure the patient, don't worry, I've seen plenty of these. I think you're in great hands. And, so you have this whole team who understands really what's happening with the lasers working around you. As I've mentioned several times, I think the patients being able to see what's happening, and also, you could come up with a case video or keep a video around to show them in an anonymous fashion, to show them what the procedure is. So now doctors are able to create their own case libraries to show. So if a patient wants to know what's involved with a capsulotomy or an iridotomy, you can show them one that you have performed. Again, all towards the end of educating your patients, reassuring them, and then perhaps providing a live view to anyone who you think would benefit from seeing it done. Yep, and so this is sort of what it looks like when you're actually at the laser. Immediately after the procedure, you have access to the videos, and then you can do several things with your videos. You can export them to a flash drive, or you can send them onto your network, and then you can also send things to your EMR as well, right from the laser. By the way, the setup to put a patient's information in to the laser is very streamlined. It's a straightforward process, and I've worked on this with my team. There's plenty of time as the patient is getting seated at the laser, as you're wiping down the laser, as we do now with COVID, or as you are numbing the patient's eye, plenty of time to put the new medical record, date of birth, and patient name in, plenty of time to export any images you've done or create a report for the laser. And that gets us to the efficiency, the practice efficiency. There are a lot of opportunities here to streamline efficiency. As I said, in my practice, the technicians are writing down how many laser pulses I do. That eventually gets sent to a transcriptionist. The transcriptionist puts it on paper, sends that back to me. I read it over, then sign it. Then we scan it into our EMR. Now you're just going to finish the laser. No one's going to have to write down any of the numbers. The laser itself has those numbers, and it will send that out to your EMR system. And from that standpoint, you could print an extra copy for the referring doctor as well. So, you just have this information, right in your EMR where you need it. Interestingly, you can also, if there's any trouble with the laser, help is virtual. And since it's a networked laser, Lumenis can just get onto the laser remotely. And I've watched this process. It's remarkable, the diagnostics they can do, and whatever it needs. They'll first of all, they'll understand what's happening with it better, and secondly, they may be able to address it all virtually. And as I said, we have documentation, so you could add a photograph of the laser to a laser report, by the way. And you could also do this, send this to insurance companies or anyone else who needs to see a copy of it. And again, you can also make your own fundus photographs and print those up as well. I'm going to just switch gears a little bit because ultimately I think Lumenis SLT is really having its moment here in the year 2020 as a first-line therapy. And I will say when COVID hit New York, we shut down quite suddenly. And I was very happy that for many years now, I have been treating my patients with laser because I knew that most of my patients had some level of protection and treatment that wasn't going to go away if the pharmacy was closed, that wasn't going to go away if they were staying at home or if they missed their follow-up visits. And there was a little bit of validation there, because I had always thought that SLT was a bit of an insurance policy for a rainy day. We are getting a lot of information that, we know patients don't take drops well. We know that they can be associated with dry eye. Patients, even when they're trying to take their drops, they miss their eye a lot. And then when the drops work, anyone who's a doctor knows they cause side effects. In fact, as I was lasering today, the biggest efficiency problem I had performing lasers was that while I was lasering people, they wanted to talk to me after the laser about their dry eye. And, I just had to say, listen, that's why we're doing the laser. We're going to get you off that drop, but, let's talk about it at your next visit. Because the way I tend to work, I have my lasers lined up and I don't want to get into the rest of the chart with the patient every time we do a laser. But, I think, the laser is dealing with the problems created by eye drops. And the LIGHT study was published in the Lancet, and 700 patients were randomized, and half were treated with SLT, including a lot of Lumenis SLT, and half were treated with medications. And the results were quite phenomenal. 75% of the SLT patients were drop-free for 3 years after, at least. Out of those sort of 350 patients in each group, 11 patients in the eye drop group went on to need a trabeculectomy or a tube shunt, compared to 0 patients who got SLT laser. There were significant cost savings. The laser was safe and effective. And as I said, Lumenis SLT was used in the study. Just that ability to avoid surgery alone, and of course we know patients who've had SLT, some of them go on to need surgery, of course, but just that risk reduction from SLT, I think is very valuable. And we have other data showing us that SLT works as well as latanoprost. And this study also showed that if the patient had never been on a drop and you did SLT, it worked even better than SLT performed on someone who'd previously been on drops. Again, that gets to the value of starting with SLT for glaucoma therapy, something I do every day. And so, I do think we're at the time to move to widespread SLT as a primary therapy. That is when the laser works its best. And here we have best-in-class laser capabilities. SmartV helps with titratable illumination, and the laser itself has superior optics and the super Gaussian beam profile. And ultimately, this is a big next step for laser therapy. It's been reimagined, and we have imaging and video. That makes it unnecessary for your practice to get a slit lamp camera. Automated reporting, connection to EMRs, practice efficiency and savings, and then live viewing for everyone's benefit.
And here we go. Here it is again to take a quick look at it. It's the digital duet. It's really a completely new generation system. When you think about it, not only does it have wheelchair accessibility, full wheelchair accessibility below, which is worth mentioning, has an ADA tax benefit, fully integrated system with SLT and YAG, but it's completely integrated within your clinic itself to share images, videos. I think importantly, not only with the patient, but with the family, as Dr. Radcliffe said, referring physicians who are interested in seeing the care that you provided and what's happened. Completely connects within your own EMR system, and you could take pictures and save them really before, during, and after treatment. Very integrated. So it's really a big step in the right direction for today's very busy practices, if you will. You go to the next slide, please. There we go. Reimagining practice efficiency, that's for sure. Documentation and education. You know, what does it do for you? It's going to capture all those images automatically. You don't need an additional imaging system. You improve that relationship with your patient. Much easier teaching tool with families, patients, or residents. And you can streamline your entire workflow activities so that you're not really slowing down to document all of this data throughout the day and move on to your next appointment. So it's very, very streamlined, and it will improve the speed of your day. Next slide, please. State-of-the-art technology. Interesting, it's really the first and only digital SLT and YAG combination with an HD camera, 12-inch touchscreen. It's very intuitive. The touchscreen is like your iPhone, really. It's very intuitive and easy to use. As Dr. Radcliffe mentioned earlier, the Smart V capability is on and off axis illumination. So you have great visualization and illuminate vitreous opacities. And the optics are really great. The super Gaussian beam profile that helps with in lowering optical breakdown. Next, please. If you are in need of a photocoagulator in your practice as well, we can actually add a Smart 532 photocoagulator that has sub-threshold capability. And again, all in one system in one lane, freeing up some room in your office. Good to note that you can purchase the digital Duet, and at a later date, if you need to upgrade and add that photocoagulator, we can add that to it at a later date. That is not a problem. So it's fully upgradable in that fashion. Either way, all in one lane. So before we go any further, let's go ahead and see if we have any questions. There is a chat box question in the GoToMeeting. If you want to open that up and type anything in there. Dr. Radcliffe, what do you think might be the typical question that somebody might be thinking or ask and be too shy to?
You know, I've always found almost at any event that I go to, whether we're talking about pharmacology or surgery, that, you know, SLT just always comes up because it's a therapy. First of all, it's not really for glaucoma specialists. It's for everyone, you know, who's treating, every practicing ophthalmologist. And you know, really, if you think about the bulk of patients with mild glaucoma who benefit from this laser early in their disease, they're being managed by comprehensive ophthalmologists, retina specialists, really everyone. And so one question that I get is whether insurance companies allow you to treat with primary laser. And to me, if I were an insurance company, I wouldn't, you know, I would kind of insist on it. I think it saves the insurance company money. It usually saves the patient money, and it often does save the practice money, mainly because we often forget how much effort and time our practice spends, you know, calling back pharmacies for, you know, brand name therapies. And, you know, if you're calculating, you know, should I get a laser or not, you know, spend a little time finding out, do you have a full-time employee who deals with the pharmacy? And do you think if you did more laser, you could cut some of that back? You know, there's a lot of resources we put into just keeping people on, you know, their eye drops.
Mm-hmm. Okay, that's very good. Excellent. Okay, I don't think we have any questions to go through, so perhaps just go on to the next slide if we could. I think, as you said earlier, not only all these capabilities to do all the things it can do, but our team is prepared to help anybody out there that wants to get together. There's a way to contact us down at the bottom. We can help you with Section 179 deductions and help educate you there, the ADA tax benefit. And of course, as you mentioned, not only streamline your practice with this new breakthrough digital duet, but there's also a revenue generating capability too with the camera system through the insurance claims for that as well. So we can walk you through all of that, and please contact us. Dr. Radcliffe, again, thank you so much for your help tonight and this presentation. Learned a lot. I hope everybody did, and be safe and have a good evening, everyone. Thank you for joining.
Thank you. It was a lot of fun.